This is the injury report presented by NYU Langone Health. All right, guys, in today's injury report, we're going to try and get an idea on why, after multiple injuries in his pitching arm the last couple of months, Yankees reliever Jake Cousins is going under the knife for Tommy John surgery. So we have Dr. Berkcan Akpinar, Sports Orthopedic Surgeon over at NYU Langone Health, because, Doc, I need some answers for this one. Something just isn't right. Your first time on Injury Report, so thanks for hopping on with us today. Let me give you a list of what Cousins has been dealing with in this right arm since before spring training. A forearm strain. Then he was placed on the 60-day IL with the flexor tendon strain. He had to pause rehab on that due to pectoral discomfort. And now there's damage to his ulnar collateral ligament, and he has to get Tommy John surgery. That was a lot of medicine words that I had to read out just now. So how do we get to this point, Doc? Could the training staff has missed something, or could Cousins just not have been transparent with the training staff with the pain, and he possibly could have overcompensated?
I mean, it's a great question, and all the injuries you listed out, they're all kind of intertwined, right? They're all somewhat related to the UCL or the ulnar collateral ligament and fall under that category of overuse, pitching related and baseball related injuries. Actually, pitching and throwing mechanics have been studied so thoroughly, especially in the MLB, and it's really quite complicated. There's a good chance he may have been throwing with a technique that his elbow effectively didn't agree with long term. And so for you or I or a lay person, one throw isn't going to really throw off our elbow biology, but over hundreds and thousands of throws at full speed, you can imagine even the smallest kind of change that isn't necessarily biomechanically most suitable for the elbow is going to have some long-term repercussions in terms of injury to that elbow from an overuse standpoint. So he's probably just inadvertently changed his throwing technique with time that's led to these injuries and inappropriate stress on the elbow. And it's actually a common misconception. Baseball players and rarely pitchers ever feel or hear a pop and can identify one throw that they can say was when they tore their UCL or when they felt a sudden jolt of pain. It's a culmination of these pitches over many years and many seasons that kind of accumulates in micro tears throughout the ligament that causes pain, and more so just laxity of that ligament and failure with time. So to answer your question, he very well may not have been. I don't think he's playing or faking the injury for some time or playing through the pain and then all of a sudden throws in the towel. It probably just gradually ramped up on him with time.
Well, when you say there could have been a change in technique, I wonder if that was something that, he changed his pitching style over the offseason, and then that could have kind of helped at least start that pain or start the process of the arm starting to break down. Because we as athletes, we're always trying to fine tune or readjust or, trying to find that competitive edge in off season. So I'm wondering if that could have been something that could have started the
Yeah.
pain in the arm to break down. Recovery typically takes between 12 to 18 months, but it could be even longer for pitchers. So when will Tommy John surgery become the NFL's ACL injury? That injury that used to be somewhat career ending or you missed a lot of time, but now players can come back from it in a shorter timeline and stronger than before the injury.
I like that you bring up ACL because there's data that shows that even with a perfect ACL reconstruction, the ligament doesn't actually incorporate into the bones until, well over a year out. So when we see these NFL players coming back at 6 to 8 months, as a fan, it's fantastic because you get to see your players play. But as a physician, you're still kind of nervous and hope that, they don't suffer another injury because that 6 to 8 months is really pushing it. In the similar context, the UCL also, right? Tommy John surgery, UCL ligament reconstruction, that also needs a chance to heal, right? As the surgeon, we position the ligament where it needs to be, but then it's effectively like putting two pieces of paper together with glue, right? You can at time zero stick them together, but then you can think about those 12 to 18 months as that glue drying. So the ligament still has to fully incorporate into the body and heal. And of course, while that's happening, we have to take into consideration that it's not happening in a vacuum, right? The muscles around the ligament, the elbow capsule, all of that has to then recover not only from the injury, but the surgery itself. And the player, the athlete has to regain that level of conditioning and high level on top of that. So that's why we're looking at 12 to 18 months. And if you survey the MLB, a recent study in AJSM just published in this year, 2025, showed the average return to sport at that level for these pitchers has been about 580 days. So believe it or not, that's even over 18 months to come back, and that's the average. So when do I think that this time frame will be shortened? Probably not anytime soon. Potentially with orthobiologics, right? PRP injections, the advent of stem cells really coming into the fore. This may be shortened over the course of the next 3 to 5 years. But as of now, there's no magic sauce that we can kind of sprinkle in during surgery to speed in this process up.
Yeah, because Shohei Ohtani is ready to get back on the mound, and I'm like, oh yeah, he had Tommy John surgery. He had it back in 2023, so time has kind of flown by, and it's like, oh yeah, it makes sense for him to be back on the mound, but that was a long time ago. We're almost, like you said, we're pushing into 2 years now. Doc, I wanted to get your expertise on this one because I'm a dad and I plan on being a baseball dad, and I read that there are reports that teenagers and young pitchers are now getting Tommy John surgery. Would you recommend that surgery for the young pitchers if a parent asked you if the surgery should get their kids should have that?
So it's a great question, and I've actually had I've had patients and parents just like you come to my office and ask that question. I think there's a really narrow population where the answer is yes. I think a Tommy John may be the right option, right? So it's really for those high level elite pitching kids who see themselves having potentially a professional career dedicated to pitching, and they really can't tolerate being positioned in any other of the positions on a baseball pitch. And they've exhausted all the conservative measures. And in that scenario, a Tommy John might be the option for that player. What's interesting is in the younger population, not necessarily a full UCL reconstruction, but sometimes also a UCL repair may provide a similar benefit for these patients. Being pediatric patients, they may heal better, and they may be able to come back a little bit earlier from a repair rather than a full-on reconstruction. But again, we always advocate exhausting all non-operative conservative measures, really making sure they're following their pitching breaks, taking a break from throwing, re-strengthening the whole shoulder, core, wrist, whole kinetic chain, and making sure they're throwing appropriately first. But as a last measure, I think Tommy John surgery is an option even for the younger generation if they're at that elite level.
Well, my kid's only 2, Doc, and I want him to be Juan Soto, not a pitcher. So surgery is going to be off the table for that one. And last question, it's the $1 million question when we do injury report. Let's say someone who's not a pro baseball pitcher needed this surgery or had damage to their UCL. What advice would you give them, and what would their rehab be like?
Sure. So UCL reconstruction is actually not an uncommon procedure in elbow trauma. Think about an elbow dislocation after a fall, right? An old person falls and breaks their elbow. A young person falls and shatters their elbow after a trauma. Though some of those injuries come with damage to the UCL, just like you can damage your ACL. Not every it's not just soccer players or football players tearing their ACLs. So if you damage your elbow in a way that also ruptures your UCL and you're having laxity of that ligament or looseness of your elbow after the initial injury period, or if you broke your bone and you had it fixed, then yeah, there's a role for a UCL reconstruction in that population as well. And of course, we're not doing it for that person to be able to pitch at 90 miles an hour, but we're doing it for them to be able to restore their elbow stability and to be able to function in everyday activities. So to answer your question, yes, there is a role for this surgery in the everyday population. And two, it's not necessarily for pitching, but it's for more basic everyday activities like doing everyday tasks around the house, personal hygiene, and just living one's life.
All right, so note to self, if someone tells me they got Tommy John surgery, that does not mean they're a professional baseball player. They could just be anybody out there. Doc, thanks for hopping on with this, man. That was very informative.
Thanks for having me.